ASAM is the professional society representing over 3,000 physicians and 5,000 board-certified physicians in addiction medicine, dedicated to increasing access and improving the quality of addiction treatment. We educate the physicians and the public, we support research and prevention, and we promote the role of physicians in the care of patients with addictive disease. So we're excited to share with you today a wealth of data on the effectiveness of and access to life-saving treatment and medications for opioid addiction. These data are timely, revealing, and show differential and limited access to evidence-based medications such as methadone, buprenorphine, and extended-release naltrexone for the treatment of opioid addiction, at a time when opioid deaths involving opioid pain relievers have been declared an epidemic by the CDC. In fact, the drug overdose death rate in 2008 was nearly 4 times the rate in 1999, a trend mirrored by increases in emergency department visits and substance use disorder treatment admissions. Now, the use of opioids, including prescription medications and heroin, has become widespread throughout the country. And in 2010, more than 12 million people reported using prescription painkillers in a non-medical manner. And moreover, this epidemic has now reached every area of the country, every segment of the population, and no group or state is untouched. Despite these alarming trends, we know that addiction is a treatable chronic disease, with recovery rates comparable to other treatable chronic diseases like hypertension and diabetes. Even better, we know that addiction treatment isn't effective in improving only the individual's health. It also reduces teen pregnancy and school dropout rates, reduces crime, improves the employment prospects and productivity of individuals, and saves families and communities. So these outcomes are possible when the disease of opioid addiction is managed by a physician specializing in addiction medicine who gives individualized treatment, which may include family involvement, psychosocial therapies, medications, and self-help groups. The FDA has approved several medications, methadone, buprenorphine naloxone, and naltrexone, both oral and extended release, for treating opioid addiction. Each medication has demonstrated efficacy in reducing drug use, and they improve patients' quality of life and functioning, and should be available as a treatment option to patients with opioid addiction. Indeed, all evidence-based tools should be integrated into a comprehensive continuum of care for addiction, as they are with other chronic disorders. You know, I said this morning that it was important for us to recognize that in treating addiction, we're not treating substance use. We're treating the disorder that leads to the substance use. So it's critical that we get our terminology correct. And if we talk about opioid addiction or an opioid use disorder, or what used to be called opioid dependence or opioid abuse, it makes it sound as if the problem has something to do with the opioid. And the problem has to do with the brain disease that leads an individual to use an opioid repetitively, despite his or her best interest. So what we're treating is what underlies the opioid use. That's what requires lifelong care. The unfortunate part of the picture is that so long as the name of the disease has opioid in it, people will think that once the opioid use ends, the disease is all better. And that's far from the case. What we need to get across to the public is that the disease underlies the use, and that's the part that needs lifelong treatment, because that's the part that, if properly treated, will lead the individual to go through the rest of their life functionally intact, with money in their pocket, and a job, and a family, and kids who love them, and an ability to enjoy a happy, productive, and full life. Without the treatment, that doesn't happen. And that's what we're here to prevent.